All right, Andrea and Zach. So I'm going to do a quick video here of your clean check. So this is where you are now. And we're going to start on the right side. As you can see, the spacing that is primarily bothering Zach is seen pretty evidently here. But I want to start over here because there would be two different ways to solve or to close those spaces. One would be to take these teeth and move them back, thereby closing the space. If you're curious, these are just the measurements of the space in millimeters. And these red buttons are the buttons that we're going to use to help move the teeth. But as you can see, if we take the front teeth and move them back to close the space, the upper front teeth are going to run into the lower front teeth. We could try to do that, but as we talked about on the phone, this is something we want to try to stay away from. We always want to try to maximize the space that the tongue lives in. Well, if we bring the upper front teeth backwards, we would be restricting the tongue space because the tongue lives within the confines of these teeth. So instead, what we want to do is take the upper back teeth and bring them forward to close the space. What that's going to do, it's going to help align these back teeth better. We like to see this point right here actually point right here. So we're off by a distance of, I'm guessing, about 3 millimeters. So it looks like 2 millimeters. So we need to take this tooth and move it forward 2 millimeters. As you can see, that would help close that space by 2 millimeters. Well, we also have 1.6 millimeters here. Well, we're going to make this tooth probably somewhere around 1.6 millimeters wider. So what I'm going to propose we do is take some composite and we're going to make this tooth bigger. We're going to make it its normal width. That's going to do two things for us. One, it's going to make Zach happier because the tooth is going to look wider, not whiter. We're going to deal with the whiter thing in a moment. And also, it's going to allow the tray material to grab onto more of the tooth. We find wider teeth do better when moving with Invisalign. So we'll have an advantage from a biomechanical perspective by putting on the composite sooner than later. How are we going to get all of these teeth to move in that direction? Well, Invisalign is going to help, but you can imagine that these teeth are bigger than these teeth. And if we're going to play tug of war, my money's on this guy and not that guy. To help us, we're going to put an elastic setup. An elastic band is going to connect from a button that's going to go on this tooth to a little slit that goes in the tray right here. That elastic will be removable, so you'll be able to remove it when you chew. If you can chew with it, great. That actually does help. Some patients can't chew with their trays in. So ideally, wear it as much as you can. And what that's going to do, it's going to help bring those teeth forward, closing these spaces. But it's also going to help us with this. We have a midline discrepancy. What does that mean? The midline of your lower jaw is right here. The midline of your upper jaw is right there. So we're off about 1 millimeter. So what we're going to want to do is actually take all of the teeth on the upper right and bring them to the center. We're not going to do as much with the left side. And as you can see, this molar, that little point right there, is already pointing there. So there's much less movement back here that we need to do in order to achieve the proper orientation of the back teeth. What does that mean for the elastic wear? We're going to give you a different size elastic for that side compared to the other side. And we may actually have you stop wearing the elastic on that side and only wear the elastic on the right side. But those are things we're going to walk you through as time goes on. In addition, the overbite, you can see how much the upper teeth overlap the lower teeth. That is something we're going to want to fix. In addition, you can see how much the teeth are square shaped. That is because if we go over to this photo here, the gum tissue is too far down on the tooth. And I was speaking to Andrea describing the idea of a turtleneck sweater is sitting over your mouth, or a long sleeve a long sleeve shirt is sitting over your hands. What we need to do is pull it back so that we put it in its proper position. Well, the body might do that on its own, so we're not going to do anything just yet. The simple movement of these teeth sometimes will activate the cells in the gum tissue, and the gum tissue will recede backwards on its own. If it doesn't happen, that's okay. We have very cool tools that will help us solve that. One is what we call a diode laser. It's a very easy way to remove excess gum tissue, but we'll do it after the Invisalign. So I just want to prepare you that that's something we might need to do. We call it a gingivectomy. Ectomy meaning removal, gingia meaning the gum tissue around the teeth. We do it very often. It's a procedure that commonly needs to be done in adolescents because their gum tissue hasn't receded back. Do we need to do this? No, but it'll make things look far better because the teeth will look much more properly proportioned. Right now they're wider than they are tall. We want them taller than they are wide. And there's certain measurements that I have that can guide me into finding out the proper proportion for you. Lastly, just trying to get a sense of why you posture forward. You can see in this photo here, your jaw is jutting forward. My gut was telling me that that was incorrect, so I had you come back, and Chantel asked you to bite on your back teeth. And when you did that, we got this bite. So these photos were taken the first set of records. This digital representation here is actually captured with a bite when we had you bite on your back teeth. This is where nature wants you. This is where you go. Why do you do this? Oh, it might be because you're having a hard time breathing and your body wants the lower jaw to slide forward so that the tongue slides forward and thereby opening the airway. We see this a lot in patients. You have a very large palatal vault, which is good. So your tongue should have enough room. With that said, that's something we're going to want to keep an eye on. I do notice that you have somewhat of a forward head tilt. And we see that in patients who spend a lot of time with their lower jaw forward. You can see how it looks like your lower jaw is jetting forward here. But we know that it doesn't because you were able to get it back into this proper relationship. Why is all of this important? Well, it might just mean your airway struggles when you're in this position. Therefore, you slide forward and your airway is okay. We're going to solve this issue as we move forward. We might bring in some other specialists to provide some insight, but that's not going to change how we solve your aesthetic concerns. I understand you want to get this done before your senior photos. That gives us about a year. We absolutely will get this to a point that you're very happy before then. I'm going to set this ClinCheck I'm going to set up the treatment plan to allow us to get to a very good spot beforehand, including some whitening time. And we'll talk more about whitening when the time comes. Let's plan on talking about that probably in March of next year. In addition, we're going to have most likely some functional things to solve afterwards. So keep in mind, I want to get you to a point that you're happy with the way they look for your senior photos, but they're not going to be completely done. This happens all the time. Patients, especially kids, they think that just because they look good, that they're done. I want you to have functional and stable teeth for the rest of your life, not only pretty teeth, okay? So hopefully that makes sense. If you need any further questions, let me know. Any further questions answered, let me know. And I look forward to getting started. I will accept this ClinCheck as soon as you guys are ready to commit. All right. Hope all is well and enjoy your vacation. Take care.